My fellow Idahoans, yesterday evening I toured a nearly full ICU wing in Boise. What I saw was heartbreaking. Among the COVID positive patients, all of them were unvaccinated. Some were young, two were middle aged, two patients were pregnant. I was told the average age of the patients was 43. All of them were struggling to breathe, and most were only breathing with the help of a machine. Doctors, nurses, and associated medical staff are exhausted. They've been working overtime for months to keep up with the demand for care, spending time away from their families. We've reached a point in the pandemic we have not been before. There are more Idahoans in the ICU with COVID 19 than ever before. The vast majority of them are unvaccinated. On a daily call with hospitals this morning, we heard there are only 4 adult ICU beds available in the entire state out of close to 400. Where hospitals have converted other spaces to be used as contingency ICU beds, those are filling up too. Idaho hospitals are beyond constrained. Our healthcare system is designed to deal with the everyday realities of life. Our healthcare system is not designed to withstand the prolonged strain caused by an unrestrained global pandemic. It's simply not sustainable. Hospitals routinely share resources when staffing and beds become limited. But all hospitals across the state and nation are experiencing severely limited staff, space, and equipment because too many people with COVID 19 need care. We are dangerously close to activating statewide crisis standards of care, a historic step that means Idahoans in need of health care could receive a lesser standard of care or may be turned away altogether. In essence, someone would have to decide who can be treated and who cannot. This affects all of us, not just patients with COVID 19. We cannot allow that to happen until we've done all we can to address the crisis playing out in our hospitals. We're pulling out all of the stops. Today, I am announcing that we're adding up to 370 additional personnel to help our hospital during the surge. We received requests from several hospitals for at least 200 additional clinical staff, such as registered nurses, CNAs, medical assistants, and surgical technical staff to help the need. They need non-clinical staff also. That is why we pursued and secured 200 additional medical and administrative personnel available to Idaho through a contract with the U.S. General Services Administration. We also requested and secured 20 additional clinical staff from the Department of Defense. The DoD Medical Response Team will be deployed in North Idaho, where we're seeing the greatest need. I am also mobilizing the National Guard once again to respond to the pandemic. Up to 150 guardsmen will support our short-staffed medical facilities. They will be tasked with logistical support such as screening, lab work, and other duties. These women and men of the National Guard have stepped up throughout parts of the pandemic to fill the needs in our communities, and we are so thankful for their service. This is on top of my announcement last week that Idaho will open 3 monoclonal antibody treatment centers across the state, where Idahoans at greatest risk of developing serious complications from COVID 19 will be able to receive therapeutic medications to hopefully avoid hospitalization and help preserve critical capacity in our hospitals. We're also directing new funds to help Idaho hospitals attract and retain the medical staff they need as they compete with healthcare systems across the nation for workers. This is also on top of my administration's announcement this month that once again we will waive temporary licensing fees for retired or inactive nurses so they can activate their licenses and re-enter the workforce more easily during this unprecedented time. This same step last year cleared the way for more than 1,000 nurses and other healthcare professionals to help out, and we hope for successful results again this time around. We are also removing barriers for nursing students approaching graduation to enter the workforce sooner, which should help in the fall. I hope it'll be enough. I hope and pray it will be enough for us to avoid statewide crisis standards of care, but we're teetering on the brink, and there's only one real solution to the crisis. We need more Idahoans to choose to receive the safe, effective COVID-19 vaccine. I want to thank the more than 818,000 Idahoans who have shown love for their neighbor by choosing to receive the safe and effective vaccine. Nearly all new COVID cases, COVID hospitalization, and COVID deaths since the start of the year were unvaccinated. The vaccine protects you from landing in the hospital or worse. Even if you aren't concerned about getting that sick from COVID-19, your choice to receive the vaccine could prevent you from spreading the disease to someone who might need medical care or hospitalization. The vaccine significantly slows the spread of the virus, and it will help our healthcare system return to normal. It is our ticket out of the pandemic. There are many of our family members, neighbors, and friends who are on the fence about getting the vaccine or have just been putting it off. To those fellow Idahoans, the time to receive the vaccine is now. As Idahoans, we pride ourselves on our independent spirit, a quality that defines our way of life. We are also a state made up of people who support each other. I wish everyone could have seen what I saw in the ICU last night. Please choose to receive the vaccine now to support your fellow Idahoans who need you. Please choose to receive the vaccine to protect lives, help our exhausted medical staff, keep healthcare access available to all of us, and keep our workforce healthy and keep our kids in school. Thank you, and God bless.